Welcome to CascadeMD, the fastest way to document directly into PointClickCare. Let's walk through how a provider completes a note from start to finish. Once I log in to CascadeMD, I can choose the facility for which I'm rounding at. CascadeMD supports multi-facility, making it simple to switch between locations in just a tap. With my facility selected, I can now see my patient list, where I can quickly find the resident that I'm seeing today. When I select the patient, I now see relevant information pulled directly from PointClickCare. This includes admission date. I also have the option to backdate my encounter or even set the risk for rehospitalization. Additional info pulled in from PointClickCare includes vitals, med diagnosis, labs, medications, and even progress notes. I can also select my template from this screen. This is a user-defined template that we build based on your existing progress note or H&P or discharge summary. We organize this with sections you're familiar with so that you are dictating against your own template. We can also pre-configure these templates to pull relevant information in from PointClickCare. This could include vitals being pulled into physical exam or diagnosis being pulled into your assessment and plan. We work with you to build your templates so that they match your existing workflow. In my case, I'm going to select my template as a progress note. And this is now going to allow me to see the sections this note is configured for. At this point, I can click Start Dictation. Now we'll already see the structure of our note. These are the sections that we've defined for this specific progress note. And you'll already notice that it's pulled information in from PointClickCare. So at the top, we see admission information like admission date, bed ID, and date of birth. Scrolling down, we start to see additional information pulled in from PointClickCare. Our vitals, our medications. Scrolling down a little bit farther, we see our labs, and under our assessment and plan, we're going to see the diagnosis as well. So instead of having to enter all this information in manually or copying and pasting, we can just select it to automatically populate your template for you. Each section also has 3 buttons, record, insert, and clear. So if I would like to dictate a component of this note, I can select the record button and it will start a live speech to text capture for this section. For subjective, patient seen and examined, mental status stable, waiting for physical therapy, denies pain, shortness of breath, no events reported overnight, slept well. And I can hit the stop button now, which will stop the voice to text capture of this dictation. If I did want to continue and add more to this, I can simply click the record button and it will append anything else that I say to what has already been placed in this section for me. With our template component, we also allow you to build your own custom phrase library. Now this allows you to take standard phrases that you might normally use, say a standard plan or a standard ROS, and instead of having to repeat those every time, insert them by way of our library. So once configured, and we'll use plan as an example here, I can click the insert button, which will show me my existing library. I can scroll through to, in this case, I'm looking for one called insert standard plans. And when I select that, it will insert a paragraph of information that I've defined as my standard plan. So again, another shortcut in being able to insert standard or common information into my note quickly and easily. As I'm done this note, I can click the next button, and now I can click the upload button. This is going to allow me to edit this note. So I can see everything that I've captured for this specific note. You'll notice every section has a blue pencil next to it. This is our edit button. So if I do need to make changes, I can click on that edit button, and I can adjust anything necessary and click save. At this point, if I do want to submit this note to PointClickCare, I can click the Submit to EHR button located at the bottom, and this note becomes a progress note within PointClickCare. That's the full CascadeMD process. Log in, select your patient, dictate your note, and submit to the EHR. Our goal is to make your documentation faster, easier, and more reliable. If you would like to see more, please book a one-on-one demo with us. And as an added bonus, everything you've seen here today is also available within our web application.